Hello, my name's Dr Peter Landsberg. I'm a rheumatologist who works at arthritisCARE in Brisbane. I'd like to talk briefly about a disease called lupus. Lupus is an autoimmune disease which can affect just about every organ in the body. By autoimmune we mean that the immune cells that should be protecting us from viruses, germs, cancer cells suddenly can switch on and start damaging healthy tissue. Lupus is really hundreds of different diseases all under the one banner. Some people with lupus will have inflamed skin. Some people with lupus will have inflamed joints or inflamed kidneys or inflamed lungs. Often no two people with lupus are exactly the same. So you could have a meeting of lupus patients and they could all look and feel different and have different experiences. It's a tricky disease to diagnose sometimes. It affects all ages, all people. Again, slightly more ladies than men, but no one is exempt from lupus. The average age to get lupus is in our most important years of our life, from childhood through to our 50s, so it really affects people while they're having babies, while they're working hard, etc. It can be quite a mild condition, and some folk with lupus just really experience bad sunburn, and other folk with lupus can have major damage to their organs, particularly kidneys and lungs. It's a complicated disease, but at the microscopic level, little hand grenades of inflammatory cells and proteins bind together, and they float around in the bloodstream, and wherever they lodge, they tend to damage that tissue, like little hand grenades going off in your skin, or little hand grenades going off in your joints, or your kidneys, or whichever organ they target. Because it's such a diverse condition, it really is a difficult disease to diagnose sometimes, and we rely on some very strict criterion. There's no single one blood test or one single x-ray that diagnoses the disease. And in fact, sometimes as a rheumatologist, I undiagnose the disease. The criteria for lupus are really based on years of experience from rheumatologists all around the world. And part of the reason for being quite precise about the diagnosis is it has huge implications for treatment, and even things like insurance. If a person tells an insurance company they're being diagnosed with lupus, it can make it harder to get a policy. So we have to be very precise about diagnosing it. The group of conditions, the things that we have to look out for are the particular types of skin rashes, things like mouth ulcers that are very dominant, not just one or two, but dozens, quite marked hair loss, very painful joints, so really severe arthritis, damages, inflammation of the lungs or the heart, and particularly the pleura and the pericardium, sacs around the lungs and the heart. Affects the kidneys, so the kidneys can sometimes leak protein and blood, and can affect blood cells, so anemia and low white cell counts and platelets can be present, and can sometimes even affect the brain. So we really have to tick quite a few boxes and be quite precise. There are blood tests that back up the diagnosis. One of the problems we have as a rheumatologist, however, is that blood tests for lupus can be positive in healthy people and do not mean the patient has lupus. There is a test called the anti-nuclear antibody, which is very common in lupus, but is also present in 1 in 9 normal people. We often see patients who have had a bit of a rash, had this blood test, and the GP is understandably fearful they have lupus, and will say, no, you don't have lupus. So that's a great relief. Lupus is very treatable. Lifestyle things are very important for lupus, and weirdly, too much sunlight is actually one of the danger triggers for lupus. So folk with lupus have to really be careful about sunburn, wearing good sun protection, good hats, healthy diet's very important for managing lupus, getting enough sleep, and then medications come into play. And the medications really target whichever part of lupus is active. So as I say, people with 3 or 4 people with lupus could be on 3 or 4 different treatments depending how they're affected. For many people it's a relatively mild condition, but other people can be quite a difficult disease. And we watch people with lupus very carefully, particularly through pregnancy and having babies, and they are monitored with regular blood tests and urine tests. When well controlled, people with lupus are well, have babies, travel the world, but they are watched very, very carefully. Once upon a time it was a disease with a terrible prognosis. Now we expect people with lupus to lead a normal and healthy life.